Hi guys, Chris Duckman, body engineer. For the guys that have done workshop level 3, this is the quick refresher. Okay, so we're assuming that we've checked for deviated uvula, we've done the self-help technique or the manual release, and these are the techniques primarily for the lower body, but integrating the rest as we go along. So just a quick reminder, the very first thing are the two assessments. So we've got the visual assessment, where we're basically looking up the body and looking for any areas of asymmetry. Is the hip higher on one side? Are the different heights of the chest? Are the hands open? Is one a fist? What position are the feet in? So we're just doing a quick visual assessment. The second aspect is the manual assessment, and that comprises of three things, if you remember. So the first one is the gentle body pull. So we're just going under the ankles as a quick recall, engaging the fascia, and then gently, with our intent, we're going ankle, knee, hip, ribs, shoulders. And as I'm doing that, remember it's not manual, it's an intent, but we're visualizing our working up through the body. And is there any areas we get restricted in? The concept here is, if we can't go past the hip, it means there's a rotation in the pelvis, and we would start our treatments here instead of up there. Okay, that's the whole concept of doing that assessment. So the second part is the Achilles assessment. So we literally go under the foot, and we're wiggling the Achilles side to side, and it's just a couple of seconds to gauge the elasticity, how much slack is in the Achilles. The third one is the foot assessment. So we're literally bridging our two fingers like this, put our thumbs across the top of the foot, and level with the ball of the foot, we're just gently pushing up towards the shoulder. Literally push. So it's not bending the toes down towards you, it's actually pushing the ball of the foot up towards the shoulder, and the toes will naturally flex. And we're just getting an assessment on how things feel. So that's the quick visual and manual assessment. Okay, so once we've done our quick visual and manual assessment, we're then going to do the hamstrings. So again, this is specifically applicable when we can't track up past the pelvis. We know there's a rotation, so the effect on the tight hamstrings, remember, is this. Tightens the abdomen, jams the lower back, compresses the neck. So if we can't pull through with the manual assessment, then we know we really need to start here instead of up there, even if there's a deviated uvula, because if not, we're working through all that resistance. So to start releasing that chain, the hamstrings, remember, can connect below the knee and to the sit bone. So the technique, just as a quick refresher, we go under the back of the knee, gently track up to where the hamstrings come in like this, and we're literally engaging the tension on the hamstrings. And remember the guy undoing the coat, just by gently pulling the collar apart, we just hold until eventually track up the hamstring, get a sense of where the resistance is, hold it until you can pull right the way through. When it releases, there's a sense that the hamstring does this, like a banana, it lengthens and pulls towards you. Okay, once we've done that, the next aspect is the calves. So two techniques to the calves. The first one is exactly the same as the hamstring. Find where the calf muscles meet, and then gently visualize the split between the two, and just hold until you feel them pull apart. Yeah. The second one, we can go behind the knee and just gently track down the top of the shin bone, looking for any areas of resistance. If we feel that resistance, you've got a choice. You can stay under the back of the knee, you can go under the middle of the calf, you can sort of sandwich and go one above the other. I would tend to put my listening hand in the area of most resistance, which is often behind the knee. Come down, do the little circle, hold, wait for that softening, widening and expansion. Okay. Once we do this, we're doing a quick assessment of the Achilles every time. Okay, and that's hamstrings and calves. Okay, so technique number 4, guys, this is retinaculum and tendon. So remember, the retinaculum are bands that come across and hold the tendons in place. We've got them in both the hands, and primarily here is the areas we work. So to check them, that's the purpose of that foot assessment. Yeah, it's just to check if any of the individual tendons are jammed. They should glide as we do that foot assessment under the retinaculum, which comes across here. So what we do is we hold the top of the foot and the ankle, and we just very gently start to engage. We do that foot assessment. So from nothing, we start to engage and flex the toes. And at some point, you may feel a resistance in your upper hand. That's where the tendons are catching. They're not gliding smoothly. What we should be able to do is to gently do this, do the foot assessment and feel nothing catch in the retinaculum. So 2 ways to do this. The first one, which will clear probably 90% of the time, you just engage, hold when you feel a resistance, keep the pressure on there, hold the barrier until eventually one by one you feel the tendons release, the foot will expand and it will just all go very soft. If there's a stubborn one, what we can do is an individual tendon assessment, and again we keep our hand here and we just do a gentle rotation of each toe. If we feel a toe that doesn't rotate, we hold it at the angle of resistance, hold until you feel that resistance. That resistance will go right the way up through to the calf muscle, release the shin, and pretty much finish off anything that's left in the lower limb. Okay, so technique number 5 is balancing the sacrum and the diaphragms. So to do this, the first technique, one hand's going to be under the sacrum and the other hand across L5, just like we've done in previous techniques, yeah? So what we're doing is we're holding this position with an intent to disengage L5S1. We want to sense that the sacrum floats down towards the feet and disengages from our other hand, okay? When that happens, there can often be a sense of, so we start in this position, but the sense is, and then it floats independently. The area that you're covering with L5, L4 will drop, widen and expand away from the midline. Okay, that's the first technique. The second one, we use this, we've done this technique in previous workshops, very, very powerful. But sometimes, especially if someone's had a cesarean, for example, or they've got very tight abdomen or tight lower back, we may need to specifically work the pelvic diaphragm itself. So one hand stays under the sacrum, the other hand drops very, very gently onto the lower abdomen, and remember our thumb or our little finger, depending which side of the body we are, makes contact with the top of the pubic bone. So if we're uncomfortable in finding that, we ask the person to find their belly button, gently head south until they hit bone, show you where that point is, and that's the top of the pubic bone. We would then make contact just above that point, and again it's a sense of go into the right depth, find the right angle, and wait for that softening, widening and expansion. Okay, we get the best results by tuning into the sacrum left and right. Come up the triangle with your intent, and if there's any areas of resistance, you'll feel it. You'll feel it suddenly appear in your upper hand. So the technique's finished when they're floating apart and there's nothing on the pelvic diaphragm that's influencing the sacrum. The third aspect, we've covered this in previous workshops. Again, hand remains under the sacrum. We're spanning both ASISs until we get that sense of right goes to the right, left goes to the left, and the tail is just dropped and floating independently. Okay. Okay, so next technique, if you recall, we're balancing the diaphragms and we're introducing one new one. So the respiratory diaphragm, then we've got a hand on the side of the ribs. We've done this before, okay? So you can put your listening hand wherever you like, but it might be an idea to either go across the left shoulder or under the back at T12. Make contact with the ribs, and what I want you to do now with your level at level 3 is to start getting used to the concept of, instead of getting up and walking around, when you've done one side and you've got that sense of softening, widening and expansion, just gently lean across. So if my hand was on the left shoulder, I'd wait for this diaphragm to release, this respiratory diaphragm, and then I'd just lean across to save me going all the way over and break in the treatment. It's so much easier and time and cost effective to do that. As soon as I get that release, I'm then interested in the thoracic. That's the second part of the respiratory diaphragm. So our upper hand would go under the neck at C7T1. So remember, if you run your hand down the back of the neck, that little ski jump of a bone is C7. You want that in the palm of your hand. And your other hand very, very gently comes across like this and makes contact with fingers and thumb on the top of the collarbone, and the rest of your hand resting very, very gently on the top of the thoracic. Again, getting into the right depth, that causes the response underneath. Vary the angle, use the circle. When it's finished, there's just that sense of softening, widening and expansion. Remember the twist coming out of the balloon. Okay. Third technique for the diaphragms is the new one that we introduced. This is the hyoid. Very, very, very powerful, and you have to be very sensitive here, not only on a physical level but on an emotional level. This is the avenue of expression. Okay, so a lot of people hold a lot of emotion here. So with this hand, we're going to move up from C7. So we're just covering the neck cervicals, just literally rest across the neck. Rest your arm across the shoulder so you're not under any load yourself. And then remember, we go underneath the chin and just gently track down until we reach a stop point. Fingers about 2 inches apart. When we reach that stop point, that's acupuncture point stomach 9, and we'll be holding the hyoid. Very, very, very gentle. And just remember, always check that the person is comfortable with your fingers there, because they may have experienced some kind of strangle in the past, and this is a very, very sensitive area, yeah? So always check that they're happy, and at any point, if they're not, you disengage. So the concept here, I'm making contact with the hyoid, I'm under the neck, I'm visualizing the muscle connections that come from the chest to the hyoid, from the hyoid to the back of the neck, and then from the hyoid up into the head. So the best way to do this is with your intent, you visualize a half moon. Start in the chest, track up the left side, track up the right side. The areas of resistance, we know this now, hold, tune into it, wait for the release. The technique is finished when you get a sense that you're holding the hyoid and the neck has just dropped. You'll also start to pick up, ideally, 2 pulses that are running down through your hyoid connections as the acupuncture point stomach 9 releases. Okay, well done. Great stuff. So by the time you've done that, you're going to have one pretty well balanced body. Integration, this works really, really well. It's just something that I've devised across the years, and it just kind of tidies up the loose ends. So we're just going to go under the ankle, under the back of the knee, and I want you to visualize the leg with 6 lines coming around it. So imagine the leg is in the center of the tube. You hold here and here. Now very often as you make contact, you might get a sense that the leg wants to inwardly rotate. Don't allow it, just pop in a gentle barrier. And then start to, in your mind, track down those 6 lines. Doesn't matter if you go up or if you come down. I find the best result by starting at the top and visualizing my way down. As you begin to come down those lines, if you find one that's out of balance, hold your intent there, do the circle, wait for it to release. When all 6 lines, all 6 meridian channels line up, there's just a sense that everything goes clonk, 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 and the leg will just float out to the side with no resistance at all. It's a weird sensation. You need to do it a couple of times just to get the feeling. Once you've done that, we always, of course, do it on both sides. And the last part of the integration technique, the last part of the workshop, we do this at level 1 and level 2, is just that gentle integration. Sacrum, occiput, and begin L5, L4, L3, right the way through. Any pockets of resistance, hold your intent there, do the circle, find the angle you need to hold your mind at, wait for the release, and then remember to go back to the beginning until eventually you can talk your way right the way through, by which time we should have a nice dual rock and glide. Okay guys, so that's workshop number 3. Well done to the guys that have completed that. Any help or assistance I can provide, please just give us a shout. Well done.